And let's go ahead and clap for Nick, everybody.
Hey everybody, my name is Nick, and I'm going to be teaching you how to do CPR. So, when I was younger, I had a problem with eating too big of bites of food. And my mom always told me, take smaller bites or you're going to choke. And that's what happened. I did choke. It was Thanksgiving, I was taking too big of a bite of turkey, and I choked. Luckily, my cousin, who's a paramedic, was able to perform the Heimlich maneuver on me, and he dislodged the food. And then years later, I still had the problem of eating too big of bites of food. I was at Chipotle, choked again, and luckily my dad was able to hit me on the back, dislodge the food again. But then I started wondering, what would happen if they didn't dislodge the food, and I needed someone to perform CPR on me? So I went down to my cousin's fire department, and I went on a ride along. And they actually had to perform CPR on someone, and seeing someone perform CPR and bringing them back to life is something that you can't put into words. Seeing someone dead come back to life is just, it's crazy. And from that moment forward, I knew I had to learn CPR, so if anyone ever needed my help, I'd be able to help them in their time of need. Now, the first thing, and according to American Heart Association, 88% of people who need CPR, it happens in their homes. So you're not in a hospital where everyone knows CPR. So if any of you learn CPR, you can help your family, your friends, any stranger that you see at a store. And knowing CPR could help them 2 to 3 times their chances of surviving a cardiac arrest. And so, first thing you have to know is how to recognize when someone needs CPR. And to do that, you just have to memorize your ABCs. Airway, breathing, circulation. To check their airway and breathing, you do that simultaneously. So you place their ear, or you shake them to make sure they're dead first. So go to them, hey, are you okay? Hey, are you okay? If you don't get a response, they probably aren't okay. So next you have to do is put your ear next to their mouth and try to listen for breathing or feel the breathing, because you'll be able to feel the air come out of their mouth. At the same time, you're looking to see if their chest rises. If their chest rises even a little bit, they don't need CPR. It means they're breathing. Next, you have to check their circulation. To check circulation, you use your 2 fingers, your index and your middle finger. And while you're checking the breathing and the airway, you place your 2 fingers on their carotid artery, which is in their neck. It's right here. And you always place it closest to you. So I wouldn't go over his neck like that. I would always go like that, so you get the most accurate reading. Because a lot of the time, people have a faint pulse, and you won't be able to feel it. So to do that, you're going to get the best reading. After you're done checking to see if you need CPR, you can perform it. To do that, you need to make sure you're in a stable position. So you interlock your hands like that, over your shoulders, so I would never go like that. And you always want your arms straight, because you can't do a push-up for 6 minutes. I don't know, maybe someone who goes to the gym a lot can, but the average person can't. So you place your arms straight with your shoulders like that, interlock your fingers with the palm of your hand and their nipple line. Right here is where the heart is. A lot of people place their hand over like this. Your heart isn't on that side. Your heart's basically right here. So in the nipple line, right in the middle. And then once you start doing compressions, you want to go down about this far, about 1.5 to 2 inches. If you go any shallower, they might not be getting the adequate amount of oxygen. If you go any deeper, they could break the sternum. And at the end of the sternum, it basically forms into a dagger. If you break that, it could cause some serious damage. You want to be going to a beat of about 100 to 120. A lot of people say Staying Alive, the song. It's not too accurate because it's a little slow, but if you speed it up, like on YouTube, if you press 1.5 speed, that'd be the perfect speed. After you're done performing CPR, and they're alive, you're alive. You want to place them into what we call the recovery position. And so to do this, you place them on their left side, with their knee towards their chest. And what this does is this opens up the airway. You want to place them on their left side because a lot of the time when people wake up, especially after, say they're drowning or if they just got done choking, they'll throw up. And you don't want them on their back because if they throw up, it's just going to go straight back down into the throat. They're going to start choking again. So placing them on the side, make sure if they throw up, it goes out. They aren't going to be choking on anything. They're going to be perfectly safe. You also want them on the left side because if you've ever hung off your bed and you're upside down, all the blood rushes to your head, right? So if you're on your left side, it's going to start, I was mistaken earlier, the heart is somewhat towards the left side, which is why you want it like this. Because all the blood is going to be rushing towards your heart. And in your blood, there's oxygen. So what you're doing is you're helping the heart start pumping. Placing the knee up like this helps the pain as well as helps you breathe. Like, I'm sure girls know this, if you get cramps, you place your knees towards your chest, you roll up into a ball. Same thing if you're tired or something, you always lean over, that's your first instinct. Helps you breathe. So, knowing how to recognize when someone needs CPR, how to perform CPR safely and properly will help the chances of them surviving. And then placing them into the proper recovery position will make sure that after you're done giving CPR, they're safe and they have the best chances of surviving. Thank you.